Hi guys, so we're trying to start here live on my colleague's end, Aline, but it didn't work for some reason. It kicks me out all the time, so we'll try to do it in my account and we see if it works. Let's accept. Hi, let's see if it connects you, or maybe it's Instagram. Sometimes it's just the Insta that is weird. So I haven't invited you. Avine, I have invited you. Let me know if works. We're talking about postpartum recovery today, a little bit more detailed on a C-section. If Instagram decides to join us together. Can't see. Okay. The invitation. Let me cancel, invite again. I send you invitation, or you can send me a request to join. Just press send request and I will accept it. Instagram tells me that you are not able to join. I can see your request. I'm inviting you again.
Hey, hi, finally.
Jesus Christ, finally.
Finally, we have joined over here.
It's really testing our patience today, this Instagram thing.
I don't know what happened over there. I don't know. What was it?
It just happens sometimes. Can you hear me well? It's nice to meet you online for now.
Yeah, I can see you well. I can hear you well. And it's great to have you. And like to be on your Instagram live. It's really, really, great. And today,
but you are the leader today. It's just the technical part. The technical part works better on my end.
Technical parts work better at that. Yeah. Anyways, so today we are going to have you, anesthesia, over here. You are a pelvic floor specialist, and you are in Cyprus, and you are dealing with a lot of females from past long time regarding the C-section, regarding prenatal, postnatal, pelvic floor. So over here, a lot of people have been currently joined from India also, and they the patients who I have there, they are also having that query, like because many times female do tend to neglect their pelvic floor during the prenatal period also, and the postpartum it is definitely impacted. So because when we are carrying the baby and everything, so we are more busy as a mother and then taking care of our own self. So how do you what you want to suggest, and how do you take it up at your end for the people who are taking for the specifically pelvic floor health? What you suggested?
Well, generally, I always suggest, because it's quite often people start to think about it when they start to have problems with it, right?
Mm-hmm.
We start to think about start thinking about it before you have problems. And most of the time, if like somebody is watching us and you don't even plan kids, or you're not pregnant or not yet, this is the good time to start as soon as you heard about it and as soon as you learned about it.
Exactly.
The next best step is to start when you are pregnant.
Yes.
Very few pregnancies have contraindication for pelvic floor exercises. There are very, very specific cases. Most of the pregnancies are okay to start with the basic pelvic floor exercises, with alignment, with breathing, with contraction. And this will put you 5 steps ahead also after you give birth.
Exactly.
It can prevent for you to have all these, let's say, side effects of pregnancy, maybe leaks or pains and aches, but also after you give birth, you don't have to spend all that time learning the basics of breathing, of alignment, of contraction. You all know them. And you can kickstart your rehab, and then you just layer upon, something a little bit more advanced if you wish.
Exactly. Exactly. And I also feel that because in the pelvic floor, it is not just related to Kegel exercises, which is being mostly said, it is related to a lot more because we have to focus on the breathing part a lot. And that is actually even during the time of delivery also, it is very helpful. Is that so?
Well, yes, definitely, because just gonna move a little bit back so I can also show. So back in times, it was all about Kegels. So you sit there, you do a little bit of your contraction, but we have more research. So now it shows that our pelvic floor works a lot with the diaphragm. So whenever the diaphragm relaxes, the pelvic floor relaxes, the diaphragm contracts and pelvic floor contracts. And it also works with our abdominal muscles.
Yeah.
Also, for in specific preparation for pregnancy, it's good to have general control over your pelvic floor and to be able not only to contract it, to strengthen, but also to relax and get it kind of, let's say, out of the way of the birth, because this is your uterus that will contract and push the baby out.
Yes.
So your awareness, your heightened awareness that you will learn in pregnancy will help you to have better control over your pelvic floor during delivery. So you won't be just all over the place, squeezing, releasing, holding your breath. You're not sure what you're doing. You will be more in control if it comes to vaginal birth. If it comes to cesarean section, it still will help you a lot later on with the pain control after cesarean section, and again after, for the recovery period. It will help you a lot.
Yeah. And the recovery period time when we are focusing on the pelvic floor, so that time it impacts the recovery of the diastasis part, which is there the Kegels, yes, the separation which happens. So the recovery of that also, it is being helped by the Kegels exercise, not the Kegels, but the pelvic floor strengthening actually. It's not just the where we are preventing the leakage or we are strengthening the uterus, the pelvic floor walls. If I'm not wrong.
And basically, diastasis recti is the separation of abdominal muscle during the pregnancy and overstretch of the line in between your abs.
Yeah,
right?
linear.
And to some extent, it's normal. It's natural. We need that stretch. Now, when a woman gives birth, that overstretch can stay, and there are two things that happening. There is some sort of natural healing happening to it. So when somebody comes to me 2 weeks after giving birth and they say they have diastasis, well, yes, you do. And it's absolutely normal. Diastasis will heal to a certain extent by itself. In some women, it will heal completely. In some, it won't. I always say that why to sit and wait? Why not to help yourself? And when somebody comes to me with diastasis, never I will treat diastasis separately and forget about pelvic floor.
Yeah.
It is always goes hand in hand with pelvic floor engagement, with abdominal engagement, with breathing, positional changes. So that comes in the pack 100%. Neither do I treat pelvic floor separately without looking what's happening there with abs and what's happening there with the diaphragm. As well as many women will have this so-called mummy pouch.
Exactly.
And when you check physically, there is not much of a gap there, but the abdominals are overstretched. So we're not talking about purely closing the gap. We're talking about getting the muscles back into that function, into that springiness, contraction, relaxation, and support. So it's also that thing coming on. We don't look just at the gap. Is it smaller? Is it bigger?
And it is definitely, I feel that it's not like second pregnancy is more impacted, where the abdominals are more loose in the post the first pregnancy and the second, third pregnancy when they happen. That time it is more seen that the muscles remain loose that time. They are not recovering back, and that time we have to be preparing it properly.
That's true. That each pregnancy in itself. So I've seen my clients after the first time. I always will have second plus moms, and they say after first pregnancy I was fine, flat tummy, and nothing wrong. After second, third, it went on. First of all, yes, the body was already stressed out by first pregnancy.
That's
Very likely that there was not rehab happening. And third, we also have another child to run after, to live, to take care, so more stress on the body.
more stress on
So
the body.
definitely, I know it's overwhelming usually for the first-time moms, but if it's possible to start in pregnancy and not to leave it and think, oh, I have my kids first, how many you want, 1, 2, 3, 4, 5, and then I do it.
Yeah.
No, do it after each
Do it
pregnancy.
after each pregnancy, and during the pregnancy too, it is very important to
Yes.
take care.
Exactly. And during the pregnancy, and we're talking about, people get overwhelmed. They're like, oh my God, I don't have that time. We're talking about, in the beginning, you might need to dedicate a bit more, like 8 weeks, maybe half an hour, 3, 4 times a week. But then 15 minutes max daily, 10 minutes of simple exercises just to upkeep the results.
Exactly. That is actually basically they have to be giving time to themselves, and that to 10 to 15 is more than enough to give that time for their body. That is very, very important, and not to neglect their self in the role of mother. Yeah. So next, I want to definitely take it up with you is the C-section, which is where the C-section scar is being very much overlooked by females post-delivery, and they are not even taking care of the scar management. Once the healing happens, that adhesions can form up, cannot form up, but that is very important that we take care of those scars post delivery and give that time for that body to recover and then get sensitization over there properly. So
yeah. I will just take a little bit of So basically, you get the whole pregnancy overload and overstretch on the pelvic floor and abdominals, and then if you end up with a C-section, you also have a scar, right? And most of the time, doctors send me for recovery all the arms, legs, spines operation, and nothing ever happens with major abdominal operation. So this is your tummy. And what you get in the cesarean section scar, you get a cut through the whole layers of the muscle, because the last layer is the uterus and then the baby is in the uterus. So you get one horizontal scar.
Yes.
Then you get one vertical cut along your muscles, because you will not be cut along the muscles. You will getting cut in the linea alba, in the white line. It's more natural.
Yes.
Quite often this scar is left unstitched. All right. It's left to heal by itself, and this is why women have a lot of sensitivity here, quite a lot. And then there is another scar in deeper layers in the uterus, so 3 scars, okay? It's all get stitched. You get stitched your muscles, your fascia, and all the small nerve endings, so everything gets stitched up, and quite often women end up in this painful protective mode by slouching, okay? I'm just going to get up here a bit. Yeah. So they end up like this. And
true, that's the posture too.
Yes, and the brain gets used to it, and the brain starts to think that this is normal. So you get all this inhibition from the scar pain, from the scar tension. You can't really walk straight. You can get referred pain into your back. Your pelvic floor contraction might not be as strong. Diastasis recti chances with cesarean section is slightly higher, probably because of that cut.
Yes.
Yes, and this is why the scar massage, gradual one, plus some simple exercises to stretch the area and to start working it back again is very important, and it's really huge investment into your future health.
Exactly.
From that perspective.
Yeah. So most of the time it is like even that time when the females are feeding the baby also, that time they are also into that slouch position. They try also not to, because it's long duration of feeding in the initial time when we have to actually take care of it. Like within the first few weeks, it's very important post the suture healing, or that time also we need to start some little massage or some little focus on breathing exercises to get that circulation improved. That is also very important, which can help in this scar healing.
Well, that's true. I have a couple of lives, and I also have some videos on my YouTube account completely for free. You don't want to start massage before 6 weeks because the natural healing process is happening of the scar, and we want the scar to be strong. We don't want it to split open. However, there are such things as indirect scar massage, where you massage the abdominal area around very gently to start to get used to basically touching the area, and definitely some gentle movement and breathing. I have again a video on my YouTube channel. It's called few exercises you can do from day 0,
That
even
would be
after
really
C-section.
helpful.
Yes,
I will definitely
you
pin
can
that
check it
from,
out.
yeah.
I would say do not stress about, we already have a lot of stress about after having baby. Do not stress about slouching. Okay, we all slouch. Body takes natural position. It's just to be aware about dropping 8-10 minutes of that time during the day, maybe before bed, or whilst you just sit, maybe when you feed the baby, just to breathe, or to open your shoulder, or to go to the wall and do a couple of arm openings. So, as you said, very small steps. To create a habit is much more important of those small steps than to take huge, big
Huge
recovery
stress.
program immediately.
Yeah, that is true. The basic thing is that we should be giving that much focus that, okay, these are the small steps which we start from the time before birth, then goes on, and when we take care of that, we will be able to build a better body, and that strength will give us much better, what do you say, that confidence, and that postpartum
Function as
strength also will
well,
be
better function. Yeah.
exactly.
It will provide you with better function, and guys, honestly, if nothing else motivates you, if nothing else motivates, it will save you a lot of money in the nearest future for your health and in the furthest future for your health. Because these things left untreated can create chronic pain in the back, can create
Exactly.
chronic weaknesses, can create chronic bloating. Eventually, things might go after menopause. If you didn't take care of your pelvic floor and your scars, uh, chronic pain, prolapses, and so on, and it will cost much more expensive to manage that. I always tell people, nothing else motivates you, money motivates everyone. So it's literally an it's literal investment into your future.
Exactly. Those 5-10 minutes are basic investment you do in the initial part for your later. There was one recently. I had a client of mine. She was actually not. She was actually of 40 plus age, but her pelvic floor and the diastasis was not cured in the time, and she was not aware also. So, as and when time passed out, she ended up with the prolapse of uterus because of that. So, it's very, very important that we start focusing on these part and that chamber of our abdomen, where we are creating that upper diaphragm, the lower part of our pelvic area, and the lateral abdominals and the core completely. We focus on that. That will be really helpful. If that
Well, yeah, because what our organs, our inner organs, there is a lot of fascia of that kind of. It's not very stretchy. It's like a semi-stretchy tissues, and over the time they lose their elasticity. We over the time we lose our elasticity. We get wrinkles. And the same with our inner organs. Same with our fascia. So what is left is the strength that we create from the muscles, but also fascial quality that we create by movement and by good nutrition and hydration. So if your nutrition and hydration is good, if you keep moving in the different directions, keeping that fascia restoring and elastic, it will support to the max possible your inner organs, and also will recover around the area of diastasis recti, because this is the fascia that gets separated.
exactly.
These are the fascial tissues.
Yes. And another thing, there are times when the female, feels that they don't want to touch that scar. They feel that, okay, it's very, very difficult to, go and touch it because maybe it has pain, it's paining also, and they feel tender also. That even after, couple of months, post-delivery. So how do you suggest them for this thing?
Mm-hmm. Quite often I see this a lot. Sometimes it's associated, I need to mention this, sometimes it does associate with the traumatic birth.
Mm-hmm.
It's not physically, it's
Mm-hmm.
the psychological aspect of it. And we're not going to now dwell on it, but the people the moms need to be aware of that. Maybe they need to find some support. It can be psychologists, it can be mothers groups, it can be, a social worker, whoever is responsible for that bit. I will have talk about it, but it's a bit a topic in itself. When it's from purely physical, like more physical point of view, understand some people are a little bit squeamish, they don't want to touch it. You can start, first of all, touch around the area. You don't have to jump on the scar, right? You
Correct.
can touch around the tummy, on the side of your hips. You can do this. Sometimes you can use a brush, makeup brush, and
Makeup
just
brush.
brush.
That's very sense. Yeah.
When you go to the shower, let the water run on the scar. When you wipe yourself after shower, rub a little bit with a towel around that area. I even suggest that I have this, I made a reel on it. I have this nice facial vibrator to clean my face.
Uh-huh.
And I suggest any like vibrating. It can be a sex toy vibrator, but it can be like mine is the face cleaner. Use
Yeah.
vibration on and around the scar after 6 weeks. So different indirect touches to desensitize it. And a lot of breathing and exercises, even if the scar won't be touched and massaged, even if somebody's like, no, I'm not touching it. Even through the movement and breathing and exercises, they will still do great job in recovery.
Yeah, that is actually going to help.
I have a whole program on that thing there as well, on the C-section recovery scar.
That is great. That would be really great for people who are seeing to go through that program and check it, because that would be actually because that the feeling of that fear that we are not going to touch it will be actually removed. So apart from that, the different textures, I guess that would also be, clothing textures would also help them to feel that the sensitization, because nerves are being cut, and those things would help in improvement of the sensation at that area and the recovery part also.
Mm-hmm.
Yeah.
Yeah.
Okay. Anything anybody has over here, if in our people who have joined, anybody would want to ask from anesthesia anything?
Guys, I'm ready to answer your question. It's a big topic. It's quite a big topic. So people
It's
are a
quite
bit over.
exactly, that is true. Okay, and so anesthesia, if it would be great if we can take any other topic in the future with you for sure. Again, related to pelvic floor, where you can teach a lot of because there are a lot of exercises which can be covered, and we have like we have time crunch. But if those can be covered in the next session, or anything you want to teach right now.
Yeah, well, we definitely can arrange like a live session where we can do like 3, 4 basic exercises anybody can start with.
Okay.
Not just to get into that mode of doing something. Definitely. As I said, on my YouTube channel, plenty of exercises there, guys. You can take one. I also have one live here, but I think I also transfer it to YouTube if you prefer, maybe, because sometimes I maybe speak a bit too slow with someone and they want to make it faster. I have this your first post-pregnancy workout. There's a lot of breathing and a lot of body awareness. So definitely check it out. It's completely free, and you can repeat it for several times before you feel like you can move on to something else. So yeah, there is some resources there, and we can definitely arrange something in relation to pelvic floor recovery, or maybe something for diastasis or diastasis assessment,
Because
or knowing if I do diastasis or is it not a diastasis, and so on.
yeah, one more thing I wanted to definitely ask, because one question which I got in recent times was where the client was saying that they felt that whether the pelvic floor is tight or they are weak, because it can be weak and tight both at the same time, which I know.
It's two different. Yeah, that causes confusion. Tight and weak These are two different things.
Yeah.
Pelvic floor can be weak, and the muscles will be overstretched, and it can be weak because it's so tight, it doesn't have potential to contract. The best thing is to explain, I always explain it with the biceps. Now, this is tight, okay? This is tight, it's contracted. How strong it will be, how much I can do with this hand, how much I can pick, not much. Now, if it's normal length, I can relax it, contract it, it will be much stronger, and now I can do some weights to make my biceps even stronger, yeah? But from here, how much weight I can lift here? Not very easy. So same with the pelvic floor. It is possible to do from, to decide if it's tight or weak, sometimes from subjective assessment, from what the patient tells you. Sometimes it's not really exactly, they might say, oh, I'm so weak in my pelvic floor, and then I go and do the internal vaginal assessment, and it turns out it's so tight. It's just so tight, and this is why it's so weak.
Yeah. So even if it is tight, that the leakage can happen.
Absolutely, yes, because there is not enough control. And to be honest, whether it's tight or weak, I always start with one thing, with breathing and posture. Breathing and posture. Is it tight or is it weak? We need that top with the breathing diaphragm going, because if your breathing diaphragm is stuck, your pelvic floor will be stuck.
Correct. And that will even lead to the, if that is not being cured in as early as possible, it will lead to other back pains also.
Yeah, definitely.
Those all things will be increased. Yes, complete posture will be impacted. So definitely we need to have one session on this specifically, because it can't be, we have to teach these clients about this. Then they can definitely, understand, and it's very important that we have to take care of our health as a female in prenatal, postnatal, and, if not pregnant also, then also we have to focus on these parts, specifically our pelvic floors and overall body posture, which we can
do the whole breathing session if you want. It's just one session, it will take only breathing. Believe me, it sounds easy, but sometimes it's not easy. But once you learn it, you get going.
You will be, yes, that's true. We will definitely have a plan for this as early as possible as you get time. So that's it. I guess if there's no question, we can definitely have a plan again with anesthesia.
Yeah, so people can write their questions if they watch the recording. They can pop a question in my DM or maybe in the comments if they want.
Yeah, and this video will be saved also, so they can definitely.
So I hope Instagram doesn't act weird. Usually it does save, and I will say it's, publish it now.
Yeah.
I hope.
So I will also repost it, so with your this channel and with your the link specifically for the C-section massage and all those things, so that people can just go and check out there, and it will be really helpful for them.
Okay.
Yeah. Okay. Thank you. Thank you so much. Thank you. Bye bye.
Speak soon. Bye.
Bye bye.